I'm Andy Stevens with Super Talk. I'm here today with Dr. Nathan Smith with Magnolia Regional Health Center, cardiothoracic surgeon. Appreciate you having time for me today to talk.
Thank you, sir.
So I had a question that came up that says, what causes lung cancer? Can you tell me a little bit about that?
Sure, thanks, Andy. So there are lots of different causes of lung cancer. Some of the more uncommon ones would be things like radon leaking from the ground or coal mining dust from a coal worker, but by far and away, 90% plus cancer cases are caused by cigarette smoking.
If I've been a smoker before, but let's say I've quit years ago, how do I know if I've got lung cancer?
Well, we have some lung cancer screening tools. A CT scan is the best one that we know of at the moment. And if you have been smoking for more than 20 years and you're over 50 years old, that's sort of the elbow in the curve where the incidence of lung cancer starts increasing. And so those are very easily obtainable. It takes just a couple minutes of your time, and we can screen to catch early stage lung cancers.
So if the screening's done and we've caught something, what do we do to treat it?
There are a number of different ways to treat lung cancer, kind of four broad categories. The first one would be chemotherapy, which we've all heard about. Surgery, which is what I do to cut the tumor out. Radiation therapy can actually fry the tumor from the outside, shooting some radiation in, kind of like Superman. And then the fourth one is really cool. It's called immunotherapy. And immunotherapy has been around for about 10 to 15 years. And we trick the body's immune system into fighting the cancer specifically. So it's a great breakthrough, and it's really improved lung cancer survival over the last 10 to 15 years.
So we've looked at some different things, and let's say in my personal instance, I've found a lung mass. What's the next step?
Yeah, that can be a really scary time for folks, but good news is a lot of lung cancer is very treatable, especially if you catch it early. I need to answer two questions to get it treated. First is, what is it? Is it an adenocarcinoma or a squamous cell carcinoma or another type of lung cancer? And then second, how far has it spread? Lung cancer likes to start in a spot and then grow and then start flicking off bits of itself into lymph nodes. And from there, it can spread to the bloodstream and the bone, the brain, the liver, things like that. And so which stage it is and what type it is helps me direct what combination of those four types of treatment are needed to treat that cancer adequately.
So the first step is finding out where I'm at, seeing what's going on, see if I have something, if you have a mass or a tumor, or cancerous thing happening, and then we can begin to combat it and try to defeat it. So I appreciate your time, Dr. Smith, for meeting with us and to learn more about cancer and how we can treat it and what we can do to fight against it.
Thank you, Andy. Appreciate your time.